സാധനം എങ്ങനെയാണ് എടുക്കുന്നത്? സൈഡിൽ വരുമല്ലോ, സൈഡിൽ കിടക്കും എല്ലാരുണ്ട്. Good afternoon, everybody. Good morning, everybody. Good morning. Can you hear me?
Yes, ma'am.
Yes, ma'am.
Shall we start now? Shall we start now?
Yes, ma'am.
Only 54 participants. What about the others? Huh? വരുമോ അവര്? വെയിറ്റ് ചെയ്യണോ അവർക്ക് വേണ്ടിട്ട്?
യൂട്യൂബിലുണ്ട്.
മനസ്സിലായില്ല, കേട്ടില്ല. നിങ്ങൾ 150 സ്റ്റുഡൻസ് ഇല്ലേ? എത്രയാ? How many students are there in your class? 170. 175. So what about the others? Or even
യൂട്യൂബില് ലൈവ് ഉണ്ട്. യൂട്യൂബില്
അപ്പം കാണാൻ വേണ്ടി, അപ്പം കേൾക്കാൻ വേണ്ടിട്ടാ?
അല്ല, യൂട്യൂബില് ഇപ്പോ സ്ട്രീമിംഗ് ആണ്.
ആണോ? ഓ ശരി ശരി ശരി. അല്ല, അപ്പൊ അറ്റൻഡൻസ് എങ്ങനെയാ കിട്ടുക നിങ്ങളുടെ?
യൂട്യൂബില് കമന്റ് ബോക്സില് റോൾ നമ്പറും പേരും ടൈപ്പ് ചെയ്തിടും.
ശരി ശരി. അപ്പൊ അങ്ങനെയാണ് നിങ്ങൾ അറ്റൻഡൻസ് തരുന്നത് അല്ലേ? ഹലോ.
അതെ മാം, അതെ മാം.
ഓക്കെ ഓക്കെ. അപ്പൊ shall we start now?
Yes, ma'am.
Okay. So today I'm going to take about obesity. I am Dr. Udayamma, additional professor, general medicine. Okay.
Okay.
So, what is obesity? Obesity is increase in body weight of 10 to 20% above the normal range caused by excess accumulation of fat. That is, there will be increase in the body weight above the normal range. Normal range is calculated according to the height and weight. Height, depending upon the height of that person. So, increase in the body weight of 10 to 20% above the normal range. Any problem? Okay, caused by excess accumulation of fat. And this increase in body weight can be due to, excess accumulation of fat, or it can be due to the increased muscle. It can be also due to increased muscle mass. But obesity is, the complications of obesity can occur if there is increased fat accumulation. So, as for other infectious diseases, obesity also a pandemic disease which spread from country to country and also from continents to continents. So it is considered as a pandemic disease, like our infectious disease. Which is the pandemic which is running now? Anyone?
COVID.
So COVID. So obesity can be measured in terms of body mass index. Body mass index. Body mass index is measured by dividing weight in kilogram divided by height in meter square. Height should be squared. So it is the unit is kilogram per meter square. That is weight in kilogram divided by height in meter. That should be height in meter square. And there will be urban rural variation, especially in developing countries like India. It is more common in urban population compared to the rural area. So especially in India, about 25% of the population in urban India is obese. And there are some health implications. There are some health implications in obesity. That is, most of the patients will not consult a doctor for their obesity. Some of them, those who are very health conscious may consult their doctor for obesity, and most of them will not consult their doctor for the management of obesity, and most of them present with complications of obesity. That is the most important health implication of obesity. When they develop the complications, only then they will approach the doctor for the management. And most of them diagnosed while they are going for a health screening for some other reasons, or routine health screening. They will identify the obesity, and evaluations are advised only following a health screening. So obesity is a pandemic disease, and it is measured using body mass index. I said body mass index is the height in weight in kilogram divided by height in meter square. So the normal body mass, about few words about the body mass index. Normal body mass index is 18.5 to 24.9. 18.5 to 24.9. That is the normal body mass index. That is globally. Globally, it is 18.5 to 24.9, and above 25 is overweight, and above 30 is obese. 18.5 to 24.9 is normal range. 25 to 29.9 is obese. Overweight. 25 to 29.9 is overweight, and more than 30 is obese. More than 30 is obese. And about the obesity, it can be class 1, class 2, and class 3. Class 1 is mild obesity, that is 30 to 34.9. 30 to 34.9 is mild. Then 35 to 39.9 is moderate obesity, and more than 40 is severe or morbid obesity. This is the global standard classification of obesity. Whereas in Asian population, there is a condition called as lean obese. So a person may appear lean, but the abdominal fat content will be more. So that is called as lean obese patients. So for Asian population, the classification of obesity is different when compared to global population. That is 18.5 to 22.9. 18.5 to 22.9 is the normal range. That is 23. 18.5 to 22.9 is for Asians. That is normal range. And overweight, if it is more than 23 up to 24.9, it is overweight. And above 25 in Asian population is considered as obese. That is the difference between global classification and Asian classification. It is in Indian population, Asian classification is the apt one. So 18.5 to 22.9 is normal range. Then 23 to 24.9 is overweight, and more than 25 is obesity. And this obesity, there will be increased adipose tissue, and the adipose tissue, it can be increased number of adipocytes. There will be increased number of adipocytes as well as increased size of the adipocytes. Both can occur in obesity. And the crude method, body mass index, we can calculate by measuring the weight divided by height in meter square. Then you can roughly calculate the ideal body weight by you calculate the total height of the patient and minus 100. Height of the person minus 100 is the rough ideal body weight. That is, if the patient is having 179 or 180 centimeter, that is in centimeter, not in meter. If the person is having 180 centimeter height, then you by minusing 100, the ideal body weight for that person is 80. Okay. So 150 ആണ് ആളുടെ height എങ്കിൽ the ideal body weight is roughly around 50 kg. That is the crude rough method of calculating body mass index. Then for calculating the risk of complications, other than this body mass index, you have to calculate the waist hip ratio and waist circumference itself, or you can take the waist hip ratio. The importance is so the waist circumference is measured at the level at a point between the subcostal margin and the anterior superior iliac spine. The middle point of subcostal margin and anterior superior iliac spine, you have to measure the circumference. That too, that should be measured after an overnight fasting. After an overnight fasting, you measure the circumference at the level between the central point between the subcostal margin and anterior superior iliac spine. And hip ratio is measured at the level of gluteal region, that is at the level of greater trochanter. Both greater trochanteral level measure the hip ratio. That is at the level of maximum circumference. That is waist hip ratio. You have to measure the waist hip ratio also to assess the complications. So the waist hip ratio above 1 in male and 0.9 in female is a high risk for cardiovascular or other complications, especially cardiovascular complications. Waist hip ratio of more than 1 in men's and more than 0.9 in female is important. And the waist ratio is also important. That is for men it is 100 and for female it is 88. Female it is 88. Waist ratio. Independent waist hip ratio I already said, and waist circumference more than 100 in male and more than 88 in female. Then about the complications of obesity. In obese persons, the major cause of death in obesity is coronary artery disease. The major complication, major cause of death in that is the major complication is coronary artery disease. And next is malignancy, that is cancer. Major cause of death in obesity is coronary artery disease, and next one is the cancer. Cancer, especially colonic cancer and colorectal cancers can occur in males. They are more prone to develop, obese males can more prone to develop colonic malignancy, especially colorectal malignancy. And in the female, they can prone to develop carcinoma of the gallbladder, biliary tract, carcinoma of breast, carcinoma of endometrium, and carcinoma of cervix. Okay. The major cause of death is coronary artery disease, and second most common cause is cancer. And the males, colorectal carcinoma is more common in males, and females they can develop gallbladder cancer, biliary tract cancers, breast cancers, endometrial cancers, and carcinoma cervix. Then main complications other than what I said is one is psychosocial implications in obesity. They usually they will have eating disorders like bulimia nervosa, that is excessive eating which cause obesity, and poor self-esteem. Then they will have body image disorders. And due to obesity, they themselves isolate, they themselves isolate. So there will be social isolation and also stigmatization, and they can develop depression. And other thing is patient who are having psychological problems like anxiety and depression can coexist with the eating disorders. Especially they can have depression and anxiety can cause excessive eating. So itself, anxiety and depression itself can cause obesity. And another thing is the treatment of depression. The drugs which used for treating psychological problem can also cause excessive eating. As a result of obesity, patient can develop anxiety, depression, all these things can develop. And persons with anxiety and depression, they will eat more and they will become obese. And lastly, drugs which treat depression can also cause excessive eating and obesity. Okay, then pulmonary complications. There will be, because of obese, there will be there will be exercise intolerance. That is, that they can develop exertional dyspnea. So there will be exertional intolerance. And there will be obstructive sleep apnea, OSA. Obstructive sleep apnea, that is manifested as there will be increased snoring during sleep. Obese persons will snore during sleep. So snoring will be there, and in between snoring there will be apnea. In between snoring, patient may go in for can you hear me?
ഇടയ്ക്ക്
ഡിസ്റ്റർബൻസ് ഉണ്ടോ? ഇപ്പോഴോ? ഇപ്പൊ can you hear me? ഇപ്പം കുഴപ്പമുണ്ട്?
കുഴപ്പമില്ല.
ഇപ്പം കുഴപ്പമില്ല. Okay. So psychological problem I already said. Pulmonary problem, there will be excessive intolerance. There will be exercise intolerance in the form of exertional dyspnea. Then there will be obstructive sleep apnea, or otherwise called as OSA, in which there will be snoring during sleep, and in between sleep, patient may go in for apnea. So that as a consequence, patient will have excessive daytime somnolence. That is excessive daytime sleepiness. Okay, then these obese persons can develop asthma. Then next is about the gastrointestinal complications. Obese persons can develop gallstones. Then there will be gastroesophageal reflux disease. That is, because of obesity, there will be incontinence of the gastroesophageal junction, so that the acid from the stomach is refluxed back into the esophagus, and patient can develop gastroesophageal reflux disease, which cause heartburn, aseptic disease, etc. There will be ulceration at the lower end of the esophagus, etc. can occur. So there will be gastroesophageal reflux disease. Then the next one is non-alcoholic fatty liver disease. That is, following as the person is obese, there will be, as I already said, there will be increased adipose tissue. Adipose tissue will be increase in number as well as increase in size of the adipocytes. So as in the body, there will be increased fat deposition in the liver also. So so what happens if there is increased fat deposition in the liver? There will be the development of fatty liver. So fatty liver can occur as a complication of alcoholic liver disease, but this condition, that is obesity causing fatty liver, is called as non-alcoholic fatty liver disease. So this can as a part of metabolic syndrome. Metabolic syndrome എന്ന് പറയുമ്പോൾ patient will have fatty liver, alcoholic, non-alcoholic liver disease. Then there will be hypertension, dyslipidemia, diabetes mellitus. This liver, and the next stage is non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis. Can you hear me? I think my internet connection is some problem is there. Can you hear me? Please respond. Can you hear me?
Yes, ma'am. Okay.
Okay.
Yes,
So
ma'am.
okay. Then so there will be fatty liver. Sorry, some problem has occurred. Sorry for the disturbance. Okay. Then as already said, cancer of the colon or colorectal carcinoma can occur. Then in the kidney, they can develop glomerulosclerosis, which will lead to chronic renal disease, chronic renal failure, and renal cancers can occur. And in the musculoskeletal system, so we already discussed psychological causes, pulmonary complications, gastrointestinal complications, renal complications, and the next one is musculoskeletal complications. So because of the overweight or obesity, patient can develop ankle sprains. Obese persons can develop frequent ankle sprains. And most of the obese person, they will have flat foot. And they can develop tibia virus, that is genu virus, otherwise called as knock knee. Because of obesity, they can develop knock knee. And there will be development of osteoarthritis. Because of this increased weight, they can osteoarthritis, especially of the knee joint and ankle joint. Osteoarthritis can occur. This can occur especially in elderly person or elderly obese persons. They can develop osteoarthritis. and they can develop back pain and back strain. So in the musculoskeletal system, the complications you expect are ankle sprain, flat foot, genuvarum, osteoarthritis of the knee and ankle joint, and patient can develop back pain and back strain. And in the nervous system, there will be, because obese person can more prone to develop idiopathic intracranial hypertension. Idiopathic intracranial, that is increased pressure inside the brain. So which will cause, there will be increased pressure that is conducted into the CSF. There will be increased CSF pressure. So raised intracranial tension. We can measure by measuring the CSF, cerebrospinal fluid pressure. So there will be benign intracranial hypertension, or otherwise called as idiopathic intracranial hypertension, or otherwise called as pseudotumor cerebrae. So many other causes are there for the development of idiopathic intracranial hypertension, like drugs. So many causes are there, but the most obese persons also can develop idiopathic intracranial hypertension. Then in the cardiovascular system, which is the most common cause of, as I already said, coronary artery disease. So in cardiovascular system, the person can develop hypertension, then dyslipidemia, that is cholesterol, abnormal cholesterol lipid profile, abnormal lipid profile, especially cholesterol, LDL, especially LDL cholesterol will be, LDL cholesterol and triglyceride will be increased. Then this person can develop coagulopathy, coagulation abnormalities, and there will be features of chronic inflammation, and they can develop endothelial dysfunction. Endothelial dysfunction, which will cause accelerated atherosclerosis. So heart attacks are more common. That is coronary artery disease. So endothelial disease. So cardiovascular system, there will be hypertension, dyslipidemia, coagulopathy, chronic endothelial dysfunction, and in the endocrine system, the most important thing is diabetes. Obese persons are more prone to develop diabetes. So there will be insulin resistance. Obese person, there will be insulin resistance. So there will be adequate amount of insulin will be there. There will be, because of obesity, they will develop insulin resistance, which cause type 2 diabetes. So there will be, patient may develop impaired fasting glucose or impaired glucose intolerance, both fasting or postprandial intolerance, glucose intolerance, and type 2 diabetes. Then precocious puberty, because of obesity, they can develop precocious puberty. And in females, obese females, especially obese young girls, can develop ovarian, polycystic ovarian syndrome. Polycystic ovarian syndrome can occur in young females. So it can lead to menstrual irregularities. So menstrual irregularities, which as a result of polycystic ovarian syndrome. Then, as already said, they can develop hormone-related cancers like carcinoma breast, ovary, and one thing is in male carcinoma prostate also can occur. So endocrine abnormalities, diabetes, precocious puberty, polycystic ovarian syndrome, menstrual irregularities, and hormone-dependent malignancies. Okay. So as already discussed, obesity can be accompanied by discuss type 2 diabetes, osteoarthritis, psychological consequences. All these can occur as a result of obesity. Then about the body fat distribution in obesity. There will be two type of fat distribution in the obese individuals. It can be, there will be intra-abdominal fat distribution, that is central obesity, or otherwise called as android type of obesity. That is, intra-abdominal fat is more compared to the fat in other sides. Intra-abdominal fat will be more. So that is called as central obesity, and the fat is deposited in the abdomen, omentum, subcutaneous part of the abdomen, in the omentum. This central obesity or android obesity, otherwise called as apple type of obesity. Apple type of obesity. You can see this thing, this apple type of obesity. See, the fat is deposited above the waist and above the waist. Compared to the hip deposition of fat is more deposited in the intra-abdominal region. So, and it is more above the waist. So this is called as apple type of obesity. Intra-abdominal fat, which will cause central obesity, android obesity, or otherwise called as apple type of obesity. And the second variety is called as generalized obesity. That is generalized distribution of the fat, especially more in the subcutaneous plane. So fat is deposited more in the subcutaneous tissue. Subcutaneous fat is more deposited. That is called as generalized obesity. And this is otherwise called as gynoid obesity. That is obesity is seen especially in the female type of obesity, or otherwise called as gynoid obesity, or otherwise called as pear-shaped obesity. See, this is the pear-shaped obesity. That is fat deposition more below the waist. So the shape of a pear, the body shape will be that of a pear, whereas here the shape of an apple. So this is called as pear-shaped obesity. Apple-shaped obesity and pear-shaped obesity. So, in other thing about the intra-abdominal fat deposition, this type of obesity are more prone to develop fatty liver. And they are more prone to develop type 2 diabetes also. That is because of the intra-abdominal fat deposition. This will drain into the portal vein from the intra-abdominal part. Intra-abdominal blood circulation, that will drain into the portal system, isn't it? Physiology, anatomy, physiology. Okay, they will drain into the portal vein, and the portal vein, what happens? It will drain into the liver. So certain factors are released. That's intra-abdominal fat that is produced as a result of increased adipocytes. So the factors released from the adipocytes, adipose tissue, certain factors are released, and these factors will cause insulin resistance, and which will lead to type 2 diabetes. So from the intra-abdominal fat is drained to the portal vein and then into the liver, and these factors which are released from the adipose tissue will cause insulin resistance. So nowadays the adipose tissue is considered as an endocrine organ. So many hormones and cytokines are released from the adipose tissue, especially leptin. Especially leptin. It is considered as an endocrine organ. Adipose tissue is considered as an endocrine organ. Okay. This is apple versus pear obesity, pear-shaped obesity. And about the etiology of obesity. As first and foremost thing is the discrepancy between energy consumption and energy expenditure. That is, the main thing is overeating, especially intake of high energy food. Discrepancy between the energy intake and energy expenditure. So when you consume high energy foods, that will accumulate as converted into fat and accumulate. And especially what happens is when a person become obese, they become more they will not become active, they will not be active. So more food intake will cause obesity, and obesity will cause the patient inactive. So that will again contribute to that is energy expenditure will become low, and that will again contribute to the development of obesity. So cumulative effect of subtle energy excess. So there will be accumulation of energy. Accumulation of energy in the form of fat, isn't it? So if you take an excess calorie intake of requirement in the 0.5% of excess food consumption. Now, 1,200 calories are required energy a patient. We calorie calculate sedentary ano, active ano, overworked ano. Sedentary lifestyle maximum 1,000 to 1,200 calories energy madi. Upon adinte or 10% excess energy food consume that will cause an increase in weight of 1 kg over an year, over a period of 1 year. So if you excess adequate amount in excess energy in the form of food, they will develop obesity. Then next thing is if the children are obese, they will more prone to develop obesity when they become adult. The most important thing is if the child is obese below the age of 3 years, the chance of developing obesity in adulthood is less or even absent. If the after 3 years, if they are not obese, the children that is children with who are chubby before the age of 3 years, there is no much harm in that. And if they are chubby after the age of 6 years, obesity developing in children after the age of 6 years, they are more prone to develop obesity when they become adults. That is the important thing. And as in children and also adults, number of hours they are spent for watching TV, and the level of physical activity, number of hours they spend in front of the TV, that is also important in the development of obesity. Ipo namukku parayan pattula ellarum indoors aanu alle, because of COVID. All most of the community are indoors watching TV. So chance of developing obesity is high due to this pandemic, isn't it? Then, so as already said, increased energy intake, that is due to increased portion size of the food. Food increased portion size of the food. Then in between, snacking in between, along with if they are taking snacks in between, or they are missing in regular meals miss cheyidittu snacks koodudal kazhichalum, they are more prone to develop obesity. Then increased energy dense food, fat and sugars, especially drink like Pepsi, Cola. These are bland bland sugar solution. Bland sugar solution. So those who are taking these energy drinks are also prone to develop obesity. So increased portion size, snacking in between with the missing major food in between, regular meals in between, and increased energy dense food, and also the affluence. All this can cause obesity. And decreasing energy intake, especially if they are on they own a vehicle, they will not walk. So car ownership, bike ownership, all these can cause obesity. On the other hand, if they are using a bicycle, it is better. It will reduce the weight. They will exercise by cycling. Then nowadays, children are rarely walking to the schools. They will choose school bus or own vehicle. So walking to the school or walking to the workplace, decreased walking to the workplace. All these can cause obesity. Then increased automation. That is, machines are doing most of the work than the individuals. Manual labor, decreased manual labor. Because of the development, machines are working, machines are doing more work compared to the manpower. So that is also cause decreased energy expenditure. Then other things are decreased sports in schools, then increased time spent on computer games and watching TV. Most of the children prefer the computer games and watching TV than compared to outdoor games. So these are the causes which cause then who are susceptible to obesity. That is varies between individuals. And the most important thing is genetic influence. For children born to obese parents, they will become obese. Most of them will become obese, and there will be some genetic influence also. Some disorders like single gene genetic disorders, that is called as monogenic obesity. Monogenic obesity, that is single gene disorders, otherwise called as monogenic obesity. Monogenic obesity. These single gene disorders like mutations for melanocortin 4 receptors, mutations for melanocortin 4 receptors, and mutations in the leptin gene. As already said, leptin is a cytokine like molecule. Leptin is a cytokine like molecule synthesized from the adipose tissue, and the effect of this leptin is it will decreases the food intake by increasing the satiety. So leptin, so what happens in mutations in the leptin? This will cause decreased leptin level, so which cause hyperphagia and obesity. Leptin deficiency can cause hyperphagia and obesity, along with other reduction in the metabolism. There will be elevated levels of glucocorticoids. All this can cause obesity. So leptin, decreased level of leptin, which due to the mutation in the leptin gene. Then certain other syndromes are there which cause obesity. One is Prader-Willi syndrome. Prader-Willi syndrome is obesity, mental retardation, then hypogonadism. Also this can constitute Prader-Willi syndrome. Then Lawrence-Moon-Middle syndrome also. Then again hypogonadism, obesity. So these things can cause obesity. So genetic influence. These are the genetic influences which causing obesity. And most important thing is monogenic obesity caused by single gene disorders. Then other causes, as I now mentioned, endocrine factors and hypothyroidism, that is deficiency of T3, T4, thyroid hormones, deficiency of the thyroid hormones. That is due to central causes or peripheral causes. That is due to deficiency of thyroid hormones. What happens? There will be, in hypothyroidism, patient will be inactive, low BMR, no body metabolic rate. So there will be obesity in hypothyroidism. Then in Cushing syndrome, that is adrenal deficiency, patient can develop obesity. Then hyperinsulinoma, hyperinsulinism due to insulinoma, that is tumor which produce insulins. So insulinomas which can cause obesity. Then certain hypothalamic tumors or hypothalamic injury, all these can cause obesity. Then so many drugs are there which cause obesity. As already I said, psychotic drugs, antipsychotic drugs can cause obesity. Example, olanzapine. നിങ്ങൾ pharmacology പഠിക്കുമ്പോൾ നിങ്ങൾക്ക് മനസ്സിലാവും. ഇപ്പൊ തൽക്കാലം ഇത്രയും മാത്രം മനസ്സിലാക്കുക. Certain antipsychotic drugs like olanzapine can cause obesity. Then certain sulfonyl ureas, like glibenclamide, glimepiride, all these can cause obesity, weight gain. Then thiazolidinediones can cause weight gain, and even insulin can cause obesity. Then pisotifin, then glucocorticoids, that is steroids, can cause obesity. Then sodium anti-epileptic drug like sodium valproate can cause obesity. Beta blockers, these are the common drugs which cause obesity. That is antipsychotics, oral hypoglycemic agents like sulfonyl ureas, thiazolidinediones, and insulin. Then glucocorticoids and sodium valproate, then beta blockers. All these can cause obesity. Then about the clinical features and investigations. The main aim of investigating the obesity is to quantify the problem of obesity, how much it is, which grade the obesity is. That as the grade increases, the chance of complication is more. The more upward slope of the obesity, the complication will steep high. So the aim of the investigations are to quantify the problem of obesity, then to exclude the underlying cause, like as already mentioned, hypothyroidism, Cushing syndrome, hypothalamic causes. All the when you identify in proper time, then only you can treat, you can correct the condition. So identify the exclude the underlying cause, then early identification of its complication. ഞാൻ നേരത്തെ പറഞ്ഞ പോലെ cardiovascular complications, diabetes, hypertension, all these things can be should be identified earlier to treat earlier to prevent the mortality due to the complication. Then to reach a apt management plan. These are the aim of investigation. So to quantify the problem of obesity, to exclude the underlying cause of obesity, to identify the complications of obesity, and to reach a proper management plan of obesity. These are the things when you keep in mind when you investigate a patient with obesity. So this is already discussed earlier. That is body mass index. So one correction is there. Waist circumference less than 94 in, that is the latest thing. 94 centimeter in men and less than 80 centimeter, that is the ideal thing. And if it is more than 94 to 102 centimeter, that is more than 100, more than 88 in female. Okay. These are the this already other things all I discussed. Then how will you investigate? That include the dietary history. A detailed dietary history should be taken. Detailed dietary history and history of weight gain. Then you have to in the clinical features, if the person is most of the persons are middle aged and females are more affected than the males, and the male to female ratio is 1:5. And clinical features as already discussed, that is complications, you can say as the clinical features. If you have to take a detailed history or detailed dietary history of weight gain, and you have to do a thyroid function, TSH, T3 and T4, and to diagnose, to rule out the adrenal abnormality, you have to do an overnight dexamethasone suppression test and 24-hour urine-free cortisol. These are the things to Cushing's syndrome, to diagnose Cushing's syndrome. So dietary history of weight gain, thyroid function test, overnight dexamethasone test, and 24-hour urine-free cortisol. Then about the like now we discussed about the monogenic and syndromic causes of obesity, that is genetic studies, and also the syndromes associated with the obesity you have to be kept in mind. Then assessment of the cardiovascular system. You have to clinically assess the cardiovascular system, and also through investigations like ECG, X-ray, echo, all these things you have to do. Then you have to check the blood sugar, that is fasting blood sugar, fasting blood sugar, postprandial blood sugar. Then you have to assess the hemoglobin A1C, that is glycated, otherwise called as glycated hemoglobin. That is a reflection of blood sugar level for the last 3 months. The lifespan of the RBC, anyone?
120 days.
120 days, that is 3 months, isn't it? So hemoglobin A1C, throughout the lifespan you can assess the blood sugar level, that is glycated hemoglobin level, that is for 3 months, as control of blood sugar for the last 3 months by assessing the hemoglobin A1C. Then you have to, as already said, serum lipid profile. That is, lipid profile includes assessment of the total cholesterol, LDL cholesterol, triglyceride level, and VLDL. All this you studied in your biochemistry class. So that you have to assess the serum lipid level, and the serum lipid level should be measured in the fasting state, that is overnight fasting, 8 hours fasting. Over 8 hours fasting, you have to do the serum lipids and serum transaminases. To see what is the importance of serum transaminases, that is serum transaminases indicates the inflammation within the liver, inflammation. So when there is inflammation in the liver, there will be elevation of transaminases. What are the transaminases? Serum glutamate aminotransferases, SGOT and SGPT, or otherwise called as AST and ALP. These are the serum transaminases that you have to assess to exclude the inflammation within the liver. Then last part is the management of obesity. That is, I'm complete for completion's sake. I am taking this. This is more important when you become the final year. But for completion, obesity in final year, so I am completing the portion by taking the management also. So first thing is the first important thing is the health risks are reversible when you reverse the obesity. It is a reversible condition when you treat the obesity. Most important thing is advise the lifestyle to reduce the advised. And as already said, you promote the walking and cycling, especially in children and also in adult. Promote walking and cycling. So when you advise the dietary plan, you have to advise to reduce the energy, fat and sugar content of the food. And the most important, so the aim of the dietary control is to advise a dietary to advise a diet which is deficient in calories. Should be deficient. The diet should be deficient in calories. The diet should be deficient in calories, but it should be adequate in nutrients. Namalipam food restrictions parayumbom you are not supposed to reduce all the nutritional foods. You have to keep the nutritional value of the food with the that should be low in calories. That is the ideal thing. So the diet should be nutritionally adequate. And the most important thing is, നമ്മളിപ്പോ ഒരു ഫുഡ് സെലക്ട് ചെയ്യുകയാണെങ്കിൽ അത് socially and culturally acceptable ആയിരിക്കണം അല്ലേ? So the food should be socio-culturally acceptable. The food should be it should be adequate in nutrition, and it should be socio-culturally acceptable also. And again, the most important thing is you should not advise to skip a meal. You have to take the food at regular intervals. അതായത് നമ്മളിപ്പോ 3 നേരം ഫുഡ് കഴിക്കുന്നെങ്കിൽ ആ റെഗുലർ ഫുഡ് ഷുഡ് ബി കണ്ടിന്യൂഡ്. യു ഷുഡ് നോട്ട് സ്കിപ്പ് എ ഫുഡ് അറ്റ് എ ടൈം. സോ you should not allow them to take long interval between the food intake. എന്താ സംഭവിക്കുക? ലോങ് ഇന്റർവെൽ കൊടുത്താൽ when they ഒത്തിരി വിശന്നിരിക്കുകയാണെങ്കിൽ എന്താ സംഭവിക്കുക? ഫുഡ് കഴിക്കുമ്പോൾ they will take more. So you should not allow them to skip food in between, and regular interval they have to take the food. And most important thing is another most important thing is, I already said, reduce the energy, reduce the fat, and reduce the sugar content. You have to reduce ask the patient to reduce the energy intake, fat intake, and sugar content. But the most important thing, the palatability of the food is depend upon the fat content of the food. അല്ലേ? ഒത്തിരിയും ഓയിൽ ഒക്കെ ചേർത്താലാണ് ഫുഡ് കൂടുതൽ palatable ആകുന്നത്. So that part is very important. So you have to palatability, low energy contentum കൂടെ നമുക്ക് ഒരുമിച്ച് കൊണ്ടുപോകാൻ ബുദ്ധിമുട്ടാണ്. So they have to reduce the fat in the food. And they have to encourage to take vegetables more. Vegetables, again, when you cook the vegetables and adding like pulses, etc., then the energy intake will be more. Oil ഒക്കെ ചേർത്ത് കഴിക്കുമ്പോഴേക്കും. So they promote them to take fresh raw vegetables than cooked vegetables, and fruits in moderation, not high content. And ideal thing is reduce the weight 0.5 kg per week to maintain the level at a stretch. You are not supposed to reduce the weight suddenly. So advise them to reduce the weight at a rate of 0.5 to maximum 1 kg per week. And it should be sustained. When 5 or 10 kg weight reduce ചെയ്ത് കഴിഞ്ഞാൽ let them become stable at that level, and then they should not. What happens is weight ഒക്കെ reduce ചെയ്ത് കഴിയുമ്പോൾ പിന്നെ ആൾക്കാർ എൻ്റെ weight ഒക്കെ നല്ലോണം കുറഞ്ഞല്ലോ എന്ന് വിചാരിച്ചിട്ട് they will take food. അപ്പം അതും we have to advise them not to take food when you reduce the weight, more food. So if there is a definite indication to reduce the weight, like they are going for a surgery, then you have to advise them to reduce the weight by 1.5 to 2 kg per week to reduce a rapid reduction in the weight. But that is not advisable. So that food advice is very important. And another thing is labor saving devices and sedentary work should be avoided. Labor saving devices should be avoided. Those who are sedentary works and passive leisure activities should be advised to become more active. And as already said, the slope of relationship between obesity and its complication will become steeper with the increase in body mass index. So complications slope, obesity slope increase ചെയ്യുമ്പോൾ the complications in the graph, it will rise steeply. And the advisable thing is to reduce the weight by 5 to 10% of the body weight. That is the reasonable goal. നമ്മളിപ്പം 80 കിലോ ഉള്ള ഒരാളോട് അതിന്റെ ഒരു 10% വെയിറ്റ് കുറയ്ക്കാൻ management plan according to the severity of obesity. If the person is overweight, that is about 25. Can you hear me?
Yes, ma'am.
If the body mass index is more than 25, that is overweight, ask them to do exercise and modify the eating behaviors. And if there is a cardiovascular risk factors, you have to treat them also. And you ask them to take supervised low calorie diet. And that is in the left part of the picture, it is absence of comorbidity. And if the patient is having comorbidities, then the cutoff point is if there is no, the cutoff point is 30, and if there is comorbidities, the cutoff point is 27 body mass index. If the body mass index is more than 30 in person with no comorbidities, and if the person is having comorbidities, if the BMI is more than 27, you have to advise drugs. So what are the drugs you used? Then if the body mass index is more than 40, if the person is having no comorbidities, and if the person is having comorbidities, then more than 35, they have to advise surgery. That is the pattern of treatment we have to choose. That is above 25 with the comorbidities or no comorbidities, you have to advise exercise and the modification of eating habits. And if the body mass index is more than 30 in person without comorbidities, more than 30 if the person is having comorbidities, you have to advise drugs. And if the person is more than 40 without comorbidities, you have to do surgical procedure to reduce the weight. So lifestyle, what are the lifestyle advice? You have to advise. As already mentioned, behavioral modification, which is the cornerstone of the treatment. Behavioral modification in the form of exercise and eating pattern. You have to reduce the eating pattern, a regular eating pattern and maximum physical activity. Regular eating pattern which contains no low sugar, low calories, and fresh vegetables and moderate fruits. That is the ideal thing. And you have to choose weight loss diets. And as there is no role for starvation diet. You should not ask the patient to starve to reduce the weight. That is very important. So what happens if you ask the patient to starve? Other fat sources, other energy sources. Formation of ketosis. So, and a patient can develop secondary arrhythmia. That is cardiac complication due to the cardiac arrhythmia. Patient can develop atrial fibrillation, tachycardia. So many cardiac complications can occur, and there will be electrolyte disturbances also. Hyponatremia, hyperkalemia, all this can occur if they starve. So starvation has no role in weight reduction drug regime. Nowadays, ketogenic diet are some are advocating ketogenic diets, but the safety of this ketogenic diet is not yet proven. Then if you rapidly lose the weight, what are the side effects? Patient can develop orthostatic hypotension. What is orthostatic hypotension? Patient in each upright posture, patient can develop BP fall and patient may become giddy. Giddiness and fall can occur. So patient can develop orthostatic hypotension. Patient can develop diarrhea, nausea, headache, etc. can occur. So rapid weight loss can cause orthostatic hypotension, headache, diarrhea, nausea, etc. Then about the drugs. This also I am just saying for the completion's sake. You will you have to review this drugs, all this after your pharmacology classes. So many drugs are previously used that are banned for their side effects. Nowadays it is used drugs. One is orlistat. Orlistat inhibit the pancreatic and gastric lipases. So it will what happens if there's a pancreatic and gastric lipases? It inhibits the absorption of the fat from the intestine. So that is the mechanism, that it will decreases the hydrolysis of ingested triglycerides and reduces the fat absorption by 30%. And orlistat is not absorbed when you give orally. It is not entirely absorbed. And what about the dose? It is 120 milligram with each meal. And the side effects of orlistat is loose stools, oily spotting in the feces, fecal urgency, flatus, and malabsorption of fat-soluble vitamins. So patient can develop loose stools, oily spotting, fecal urgency, flatus, malabsorption of fat-soluble vitamins. So what happens is, because of this side effect, patient himself or herself reduce the fatty food when you take the orlistat. That is the advantage. Then another drug is phentermine and topiramate, which is used in a low dose. What is the complication? Topiramate can cause teratogenicity. That is when pregnancy when you take topiramate, it will cause teratogenicity. That is child may be born with the complications. And phentermine cause cardiovascular side effects. Then another thing is another drug is 5-hydroxytryptamine 2C inhibitors. Example, lorcaserin. Then another drug is naltrexone and bupropion. Naltrexone is an opioid antagonist, and bupropion is a noradrenaline dopamine reuptake inhibitor. Then another drug is liraglutide. Liraglutide as an oral hypoglycemic agent. It is glucagon-like peptide 1 receptor agonist. Liraglutide is glucagon-like peptide 1 receptor agonist, which is used in the management of diabetes. It has another effect. It has got weight reduction, especially in obese diabetes. When you give liraglutide, the patient will lose the weight. And all these drugs, when you withdraw the drug, they can again develop obesity. And the drug therapy is reserved for patients with high risk complications for obesity. And the last one is surgery. Surgery which is done for the obesity is called as bariatric surgery. And this is most effective long-term treatment of obesity. But there are some complications also for this surgery. Surgery you can study in the final year surgical classes. Surgery, I will only say the names of the surgery. One is gastric banding. It is 50 to 60% effective. There is a band at the level at the upper part of the stomach. I will show you the picture. This is the banding below the esophagus. Upper part of the stomach, you will say you have to put a band, and all these procedures are can be done laparoscopically. So one is banding, and okay, bariatric surgery. It is reserved for severe obesity. It is performed laparoscopically, and surgical risk is very minimal, very low mortality. And the first one is banding. Second one is sleeve gastrectomy. This is second one is sleeve gastrectomy. Sleeve gastrectomy, that is a part of stomach is resected out and suturing is done here. So the food intake will be, the patient will feel early satiety and food intake will be less. So this is the then third one is Roux-en-Y surgery. Roux-en-Y surgery. This is Roux-en-Y gastric bypass. Roux-en. Other 60 to 70 to 80% effective ആണ്. The problem is Roux-en-Y gastrectomy. You can see from the upper part of the stomach, so incision, suturing is done, and a part of the intestine is sutured here. So what happens is the food, again the early gastrectomy, but the enzymes which are coming from the duodenum, the factors which absorbed through the duodenum and upper intestine are inhibited, so they will develop deficiency of vitamins. Like they can develop vitamin B deficiency, iron deficiency, etc. Hypoglycemia can occur, dumping syndrome can occur. All these are the complications. Iron deficiency anemia can occur. Then the last one is duodenal switch. That is duodenum. This is the duodenal switch. That is part of the gas stomach is resected out, and the duodenum resected out, and intestine is switched to the duodenum, that part, and biliopancreatic diversion. This part is diverted, so that is called as biliopancreatic diversion. So a very small part of the duodenum, then the very small part of the small intestine, then it is large intestine. So biliopancreatic diversion with the duodenal switch. These are the surgical procedures done for obesity. And patient can develop postoperative complications in the form of respiratory problems, aspiration pneumonia, like etc. Then wound infection can occur, wound dehiscence can occur, staple leaks can occur, and patient can have stomal stenosis, marginal ulcers can occur, and patient can develop venous thrombosis. Then of pouch and distal esophageal dilatation. Distal esophageal dilatation and pouch formation can occur, and patient can develop persistent vomiting, dumping can occur, hypoglycemia, and deficiency of micronutrients like vitamin B1, B12, folic acid, iron, all this can occur. These are the complications. And that is all for the today's class. You have to the standard textbook to study general medicine is, one is Davidson's principle, Davidson's Principles and Practice of Medicine. I think the latest is 23rd edition. Can you hear me?
Yes, ma'am.
23rd edition. I think it is the latest edition is 23rd edition. Davidson's Principles and Practice of Medicine. And another one is Textbook of Medicine by K.V. Krishnadas, Dr. K.V. Krishnadas. These are the prescribed textbook for your study. That is for theory, and practicals you have to buy Hutchison's Clinical Methods. These are the standard textbooks. Then ask the seniors. Some guide-like books are there for practical and also for the theory. But you have to read Davidson, and Davidson you have to read. Most of the teachers prefer Davidson and Hutchison. That for clinical methods it is Hutchison, and for the theory it is Davidson. And you can buy K.V. Krishnadas's textbook of medicine also. Then one thing I have to say is you have to study the portion, teach through the online platform. It is not equivalent to the face-to-face class, but you have to read. We don't know how this pandemic, what happened, when we will start face-to-face class, that we don't know. So you have to study now itself. It is very difficult to understand the practical classes, clinical classes as already started, isn't it? Clinical class already started.
Yes.
It is very difficult to understand the things which have to demonstrate only by teaching like this. But you have to read. The only solution is you have to read from the textbook. Otherwise, it will become difficult to you to understand. So you have to read regularly. That is my advice. So one class is pending there, isn't it? Padma sir's class is pending. So you have to contact Padma sir for when he can take the class. Okay. We can stop now.
Yes.
Any doubt? Okay, 12:30 aayile. Okay, we can stop now.
Thank you, ma'am.
Okay, okay.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Thank you, ma'am.